So a common question that comes up is pre-approval of medical care. Very often, especially with diagnostic studies, but sometimes with regular doctor's offices, the providers want pre-approval or guarantee from the insurance company that they're going to be paid before they'll provide treatment. The Pennsylvania Workers' Compensation Act does not require pre-approval. So let me say that again. The Pennsylvania Workers' Compensation Act does not require pre-approval of medical treatment. So when a provider calls the insurance company and asks for pre-approval, the insurance company is not obligated to give it. The insurance company is obligated to indicate whether it is an open payable claim or not, and that's it. Then it falls back on the provider to decide whether they're going to go ahead and give the treatment or the study anyway. Generally, the doctors that are familiar with the workers' compensation system know that there is no pre-approval in Pennsylvania. They know that if the treatment is reasonable, necessary, related to the work injury, it will be paid as long as it's billed properly, so they'll proceed with the care. But we do run into situations where some doctors will refuse to treat people, and there's very little we can do about it. We will talk to the office manager, we'll talk to the doctor if they'll talk to us. Sometimes we can change their mind, but most often they have a policy that's firm. Without pre-approval, they won't treat. There is one other process that allows us to file for pre-approval. It's the utilization review process, but that takes several months. So to get something pre-approved through utilization review puts a delay in the treatment of 3-4 months. So when you can't get pre-approval, what do? That varies by case and by type of treatment. Sometimes you find a new provider. It depends on if, for example, it's a lumbar MRI and you need to get it done quickly to figure out what's wrong, and one facility won't do it, we'll refer you to a different facility and try and find a facility that will proceed with the MRI even though they're not getting pre-approval. Sometimes we're able to convince the medical provider to go ahead, and sometimes there is only one provider that gives the treatment that you're looking for. There are some specific injections or procedures that are done by only a few people, and in those cases your alternative is really just to wait until we can get through the utilization review process. So it varies by case. When is pre-approval most often sought by a medical provider? I would say it's most often sought in situations where there's going to be surgery or diagnostic studies. Office visits, it's usually not a problem. But if you need an MRI, a CT scan, a lot of those providers will seek pre-approval, pre-authorization. If you're going to have surgery, it's common for especially the hospitals and the anesthesiologists to want pre-certification or pre-approval of their treatment. So diagnostic studies and surgery can be difficult to obtain without pre-approval. We often are able to overcome that by using people's private health insurance as a backup. So what happens there is we tell the provider to bill workers' compensation, and if workers' compensation were to deny the claim, then their private health insurance would have to pay it, and that encourages the provider to go ahead and provide the treatment by getting pre-approval or pre-certification from their private health insurance, even though they're not intending to bill their private health insurance, without a denial from workers' compensation. So there is another workaround sometimes.